Hi, I'm Dr. Jeannie Lawrence. I'm a board certified psychiatrist and therapist, and I help women physicians who are holding it all together on the outside but struggling emotionally on the inside to create more happiness and peace in their lives. So I'll share a story. I remember being a college student many years ago and unsure what I wanted to be when I grew up. And I stumbled across an opportunity to volunteer at a free medical clinic that was local to my college. And it was there that I fell in love with the clinic environment and the underserved population that we were working with, and this idea that I could help people. So I decided that I wanted to become a physician, and I went to medical school and then entered residency training in psychiatry. And a part of my residency training was learning about psychotherapy or talk therapy as treatment for mental health conditions. And I remember assuming that when I got out of residency and became an attending, that I would be using the full breadth of my skill set from med management to therapy and everything in between to help my patients on a day-to-day basis. It turns out that when I got out of residency and into my first attending job, I realized that typically psychiatrists are not hired and employed positions to do therapy. We're usually hired to focus more on med management. And I was okay with that for a while. But as I got further in my career, I started to realize that while med management was super important, it did have its limitations sometimes. And I wanted to provide a more well rounded approach to treating my patients. Um, but in the confines of my job, I really couldn't do that. And I started to experience some feelings of burnout. I felt like I wasn't helping patients as fully as I wanted to. And I even started exploring other options outside of medicine. But none of those options really panned out. And I ultimately decided that I was going to stay in medicine. I also decided that if I was going to stay, that I needed to reconnect with that feeling that I had as a college student and as a resident and as a med student. And that was the sense that I was really making a difference in helping. I decided that in order to do that, I would revisit and expand upon my therapy training. Now, part of learning to be a good therapist is something that we call personal work. Personal work in this sense really is just applying the same therapy tools that I might use with a client or patient to my own personal life. Certain therapies, like cognitive behavioral therapy, are well suited to personal work and can be used not only to treat depression and anxiety, but also to address the everyday problems that we all deal with, like processing a difficult day at the hospital or clinic, or dealing with mindset blocks like perfectionism and imposter syndrome that keep us from pursuing our big goals and dreams. When I started doing personal work as a part of my training, I was blown away by how effective it was. I went from feeling discouraged in medicine to really rediscovering my passion for mental health and for medicine. I went from thinking that I needed to change everything around me, from my job to relationships, etc., in order to be happy, to realizing that peace of mind and happiness is available to us even right now. And that really freed me up to pursue higher level goals, like making changes to my career so that I can practice medicine on my own terms and pursue other goals as well. I believe this concept of self work is especially relevant to physicians. The rates of physician suffering in all its forms, from burnout to depression to anxiety and even suicide, are at record highs, especially now in the context of COVID and all the many changes that we're facing in healthcare. And unfortunately, physicians don't always have easy access to care and support that feels safe and stigma free. I believe that two of the worst things about suffering are doing it alone and feeling like no one understands, and not knowing how to find relief, not knowing how to feel better. So that's why I created this YouTube channel and my content and services to provide support to women physicians and let you know that you're not alone, no matter how you're feeling, whether it's discouraged or depressed or anxious or fearful or frustrated. You're not alone. And two, to help guide my colleagues in medicine on their own journeys, their own personal or self work journeys to greater peace and happiness wherever they find themselves. So, follow me along here on this channel, follow me on Instagram and on my Facebook page, and see how I'm using these tools in my life and how I might help you as well on your self work journey. Thanks for listening. Take care.